Hello guys, welcome back to my channel Anytime Medicine, and today we are going to learn about is HMP Shunt. So before we start my video, subscribe to my channel so you cannot miss my future videos. Before we start HMP Shunt, there are another names for HMP Shunt, which are hexose monophosphate shunt, pentose phosphate pathway, or 6-phosphogluconate pathway. This is called shunt because there is glucose 6-phosphate will shunted away from the glycolysis, which is the original route for glucose 6-phosphate to make energy. So this is the original process for glucose 6-phosphate to go for glycolysis or making energy, but glucose 6-phosphate will go to the HMP process. That's why it's called HMP shunt, because glucose 6-phosphate is getting shunted away to this process. So before we start this shunting process, we need to know that HMP shunt will synthesize NADPH and ribose 5-phosphate, and it has clinical correlation with C6PD deficiency and thymine deficiency that you need to know for the exams. The HMP shunting process is all reaction occurs in cytosol, and there are two phases. One is oxidative state and second is reductive state. Oxidative state is irreversible and rate limiting step. Once it is done, you cannot go back. And second step is the reductive step, and which is reversible process of HMP shunt. So here are the oxidative reactions of HMP shunt, in which glucose 6-phosphate will turn into 6-phosphoglucanolactone with the help of glucose 6-phosphate dehydrogenase, and it will release 1 NADPH in the process. After that, 6-phosphoglucanolactone will convert into 6-phosphogluconate with the help of glucanolactonase. Then 6-phosphogluconate will convert into ribulose 5-phosphate with the help of 6-phosphogluconate dehydrogenase. In this process, it will release 1 NADPH again and the CO2. After that, ribulose 5-phosphate will go to the non-oxidative reactions of HMP shunt, which is the reductive reactions of HMP shunt that we are going to see in the next slide. So here are the reductive reactions of HMP shunt, in which we know that ribulose 5-phosphate, which is come from oxidative reactions of HMP shunt. After that, ribulose 5-phosphate will convert into ribose 5-phosphate. Ribose 5-phosphate will convert into fructose 6-phosphate with the help of transketolase, and that fructose 6-phosphate will convert into glucose 6-phosphate again, and this cycle will go on in HMP shunts of reactive reactions. So as we have seen in a previous slide, that transketolase will help ribose 5-phosphate to convert into the fructose 6-phosphate. How? That it will transfer the 1 carbon unit and make the fructose 6-phosphate. It will require thymine B1 as a cofactor, and if the person have abnormal transketolase, it will develop the Wernicke-Korsakoff syndromes. Affected individuals may have abnormal binding to the thymine, and that's why it will not be normal transketolase, and it will develop the Wernicke-Korsakoff syndromes. So in the beginning of the video, I have told you that it will synthesize the NADPH. So what is NADPH? NADPH is the nicotinamide adenine dinucleotide phosphate, which is similar to NADH that we have seen in my previous videos, and it is not used for oxidative phosphorylation for ATP, which is the electron transport chain. So what are the uses of NADPH in our body? It is used in reductive reactions, not only the HMP shunt but anywhere in our body. It will releases the one hydrogen from NADPH, and it will form the NADP plus form. Other than that, it is the cofactor for fatty acid and steroid synthesis, occurs in liver, mammary glands, testes, and adrenal cortex. Other than that, it will be used in phagocytosis and protection from oxidative damage that we are going to see both in next slides. So NADPH is used in respiratory burst, which is killing. In oxygen independent killing, there will be low pH and enzymes will work for killing the bacteria. There are main 3 enzymes for the respiratory burst. One is the NADPH oxidase, second superoxide dismutase, and third is myeloperoxidase. So here are the process for respiratory burst, which is the phagocytosis process for killing bacteria, in which O2 will convert into the O2 minus form with the help of NADPH oxidase enzyme. Also, it will need the NADPH. I have talked about that NADPH will go into any reduction process in our body. O2 minus form will convert into the H2O2 form with the help of superoxide dismutase. That H2O2 form will convert into the acid form with the help of myeloperoxidase with the adding 1 chloride into the process, and that acid form will kill the bacteria that is affecting to our body. So what if we lose the function of NADPH oxidase enzyme? It will create the chronic granulomatous disease because phagocytes cannot make their own H2O2. Catalase negative bacteria generate their own H2O2, so cell have H2O2 to use, and that's why it will kill the bacteria for using catalase negative bacteria's H2O2. That's why we will not see any fatal infection of catalase negative bacteria. But in catalase positive bacteria, they will break down their own H2O2, so cell doesn't have any H2O2 to use. That's why we will see recurrent infections of catalase positive bacteria. There are some organisms that can cause the chronic granulomatous disease infection, which are Staph aureus, Pseudomonas, Serratia, Nocardia, and Aspergillus. So thank you everyone for watching this video. If you like this video, hit the like button, subscribe to my channel, and share it with your friends.